Dr. Saliu is an associate professor of psychiatry from the Bayero University, Kano, and currently the medical director of Federal Neuropsychiatric Hospital in Dawanau, Kano. Before his appointment as a medical director, he was a lecturer with the Faculty of Clinical Science, Bayero University, Kano, and consultant of psychiatry with the Aminu Kano Teaching Hospital, Kano. Dr. Saliu has been an focal person before treatment since 2013. He is a member of International Society of Substance Use Prevention and Treatment Professionals, a member of Board of Trustees of International Society of Substance Use Professionals and Treatment Professionals Chapter, Nigeria Chapter, and currently the coordinator of International Society of Substance Use Prevention and Treatment Professionals Nigeria Northwest Geopolitical
and then
Zone.
conduct some research focus on some degrees, diplomas, and certificates for personnel that are solely into addiction science. And by then, we have enough manpower around that probably even to develop scheme of service for them will not be difficult. So that they can get jobs and they can actually offer these services. And another point I think we have to consider, of course, we have a lot of prospects in this regard that we have some personnel already that are trained. It's a very good plus. We have many universities that are involved with IUCC, ICU, DDR, and then we have some level of political will. Even our president here, with the dignitaries that are here, is a sign of some political will. We have the NDLA force here as well. Welcome. This is a very, we have had so much that NDLA has contributed, and the AUC is here, and all the dignitaries invited. They have some role to play in making these things sail through. So the political will is there, they are supporting. We have an enthusiastic nation, a very optimistic person. So I see things really, because when you take our media, newspapers, TV, radio, every day we talk about substance abuse. And I think that is telling you that the nation is ready and is ready to support things that will, I don't know, combat this menace for us to save ourselves. So I think I have to stop here because of time. Thank you for listening. Thank you so much, Dr.
I'm not sure I quite get the question. Are you saying whether it should be limited to clinical psychologists treating or
Expanding.
expanding? I mean, when it comes to addiction management, it involves more than just one profession because it affects many domains of the person's life, from his schooling to his housing to his job. So there are many domains that are impacted, and therefore you need many professions working together in addressing the issue when it comes to substance abuse disorders.
So, in terms of
We say the data is dated because it was as far back as 2018. By implication, that data showed that 14.4% of the population said they had used drugs within the previous years. This is excluding alcohol and tobacco. The question that raises, and that's already 3 times the world average, and we're saying that was 2018. If you give the predictions that have come between then and now, we're expecting that in 2030 there'll be an increase. And so, and also we're seeing different data that point to the fact that there has been a potential increase in drug use in the country. Given where we are, that's already an alarming statistics. And when you say 14.4%, that is the whole country. But when you look at it by state, it also differs. So we find, for instance, in Lagos, it's 33%. In Oyo State, it's 23.6%. In Gombe State, it's 22.6%. So it varies from state to state. But whichever state you look at is still higher than the world average, meaning that we have a problem on our hands that we need to address.
So how soon do you expect Nigeria to address this situation?
Well, one way of looking at it is, again, you find that Nigeria at a government level is beginning to recognize the need to have a program that actually addresses the problem. This is how I look at it. If you check, I think in 2000 and I don't know the dates, but 2-3 years back we had the Senate President Roundtable on this. We had the Presidential Advisory Committee on this. We had the State Houses of Assembly, the two previous houses, both the Committee on Health and the Narcotic Committee, trained in terms of having a drug prevention and treatment and care sensitization program. We had the governor's wives that went through the same program. So we find out at the government level there is a recognition of the need for programming, but they need also help in therefore devising programs and investing money both from the government and private sector in activities and events that could address the problem. So the government is doing something. When you look at it today, NDLEA, you're hearing it in the news every 2-3 days in terms of seizures they're making and other efforts that they're doing. So we commend them, but looking at our situation, there's still a whole lot more that needs to be done.
Thank you.
United Nations officer.
General Marwa has brought dynamism to drug control in Nigeria upon his assumption of office as the chairman chief executive officer of NDLEA. He left no one in doubt on his mission to frontally address the drug scourge in Nigeria through collaboration, which, not surprising, is one of the core principles of Nigeria Society of Substance Use Prevention and International Treatment Professionals. One of his strategies was to assemble some of the best brains in the field of drug demand reduction across certain organizations in Nigeria as a special purpose committee, which today stand as an advisory body to the Agency on Drugs Demand Reduction matter in its recognition of the vision of
undermines legitimate economy and threatens the stability
professional.
and security of countries. Nigeria has intensified efforts at suppressing the drug menace. Efforts, as you know, include the development of the 4th National Drug Control Master Plan 2021 to 2025, which is a strategic document to strengthen responses to drugs in order to contribute to enhanced health, security, and well-being of Nigerians. As part of our efforts towards demand reduction, the War Against Drug Abuse, WADA, was launched by the then President of the Federal Republic of Nigeria, Muhammadu Buhari, in 2021 to commemorate the United Nations Day Against Drug Abuse and Illicit Trafficking. As part of our WADA activities, the agency has embarked on intensive drug sensitization programs targeting different sectors of society, more especially educational institutions, which includes the launch of WADA clubs in these institutions. In addition is the implementation of the Unplug program, which is a school-based drug prevention program. As part of the WADA initiative is also the campaign for strengthening state drug control committees where they exist. Where they don't exist, we are appealing to governors. Only yesterday I had a meeting with the leadership of the Nigerian Governors' Wives Forum, and to encourage them in their states to appeal to their husbands, the governors,
governors, where there is no state drug control committee, to establish them and proceed to also establish local government drug control committees and community drug control committees. Also is the increased capacity building for service providers in the delivery of evidence-based prevention, treatment, and care. And I believe the addiction science being taught is going to bring forward, going to yield those who will tackle this problem in our society. I do not frankly see a serious issue on employment because we are short staffed in terms of those who have the capability and the intellectual knowledge to handle this matter in the various institutions from the grassroots up. We have also launched a 24/7 toll-free call center for families and members of the public who have drug problems to seek for help. We have the issue of stigma here. Most, or let me say some, who are addicted to drug use or are having issues with drugs don't want to go for treatment in rehab centers because they don't want to be seen. So people don't say, so person, we didn't know that he's a drug addict. So this toll-free line will be very helpful because it is anonymous. We have had several calls of people with problems on this line. They call, let's say from Maiduguri, and they ask, they want to be treated. Please tell us the address of a rehab center in Bauchi or in Yola. They don't want to be treated anywhere in their own state. The number of the toll-free number of the toll-free center is 0800 10 20 30 40, very simple. And families, not even the drug user themselves, you see, you think your son, there's something funny going on there, you can call and get help and advice. We have a team of dedicated, well-trained professionals who take calls in English, Pidgin English also, Hausa, Igbo, Yoruba. Concluding, as we deliberate on the prospects and challenges of implementing addiction science courses in educational institutions, please let us embrace this opportunity to sow the seeds of knowledge